Welcome to the deep dive. Today, we're tackling babesiosis. It might sound a bit exotic, maybe, but it's a really important disease to understand if you care about animals.
Oh, definitely.
We've gathered a ton of information on this, what causes it, how it messes with our pets, what signs to look for, and, well, most importantly, what we can actually do about it.
Exactly. And our goal here is to kind of cut through all the scientific jargon and give you the crucial info about babesiosis. We really want you to come away with a clear understanding of this parasitic disease.
Yeah.
Maybe learn a few surprising things, too, along the way.
Hopefully.
And definitely gain some practical knowledge, stuff that can be really valuable for, pet owners and really anyone who loves animals.
Okay, let's unpack this then. So, at its heart, babesiosis is caused by these tiny protozoal parasites.
Little single-celled organisms.
Yeah, they belong to the Babesia genus. And the stage of these parasites that causes the real trouble is called a merozoite or pyroplasm.
Right. Think of it as the active form.
Okay, the one that invades and then multiplies inside red blood cells.
And these little invaders, they can cause some pretty significant problems for mammals, can't they?
Oh, absolutely. What's fascinating here, though, is that it's not just one single type of Babesia. It's like a whole family. And different ones tend to affect different animals. Even just looking at dogs, we see a few key players.
Okay.
There's B. canis. That's a larger type of pyroplasm, and you find it in various parts of the world.
Right.
And interestingly, B. canis itself has a few different versions. You could almost call them strains.
Subspecies.
Yeah, subspecies based on genetics, biology, geography. They tend to hang out in specific areas, like B. canis vogeli. That's the one reported here in the United States, but also Africa, Asia, Australia. Pretty widespread.
And then there's the one with a bit of a tougher reputation, right? B. canis rossi.
Exactly. That one's mainly found in Africa, and it's known for being, well, more virulent, more severe.
Okay.
And then B. canis canis is more commonly reported over in Europe. It's almost like these different versions have carved out their own territories.
Precisely. And it's worth pointing out, scientists are still kind of debating whether these should be called distinct species.
So B. vogeli, B. rossi, B. canis, maybe separate species altogether.
Maybe. The jury's still out on that, really. It just shows how our understanding is still evolving,
Yeah.
But the B. canis story, that's just part of the picture in dogs. We also see several types of smaller Babesia parasites.
Right, smaller invaders, like B. gibsoni, sometimes called the Asian strain.
That's the one. It's spread globally now, and we're seeing it more and more here in the U.S.
Then there's B. conradi. That one's really specific, isn't it?
Super specific. So far, only reported out in California.
Wow. Talk about localized.
It really is.
Yeah.
And we shouldn't forget Babesia, Delaria, and AA, also known as the Spanish dog pyroplasm, or sometimes called B. microti-like.
Right.
The smaller one, it's been found in Spain, other parts of Europe, and yep, it's turned up in the United States too.
It really highlights how these things can travel, doesn't it?
Absolutely. They establish themselves in new places.
It sounds like a whole cast of characters in this Babesia world.
Yeah.
And you mentioned another one, Babesia sp.
Coco. Yes, Coco. That's a larger type, and it seems to, target dogs with weakened immune systems.
Like if they're on chemo or something.
Exactly. Or dogs that have had their spleen removed. We see that one here in the U.S. It's like the parasite world has its vulnerable targets.
That's a good way to put it.
And, beyond these more common ones, there are occasional reports popping up. New Babesia species, even a related parasite called T. equi.
Always something new. What about cats? Are they affected too?
They are. For cats, there's B. felis, a smaller parasite reported mainly in Africa.
Okay.
And the one we tend to see more often here in the United States is actually Cytozone felis. It's technically related, another pyroplasm.
Cytozone felis, got it. So how do these tiny parasites actually get into our pets? It's not magic, is it?
No, not magic. The main way, the classic route, is through ticks. Right. These parasites live inside the ticks, and then when the tick bites an animal, bam, they get passed on.
Makes sense.
But, and this is important, there are other routes too.
Oh.
Direct blood transfer can happen. Think dog bites.
Okay.
Blood transfusions.
Wow.
And even from a mother dog to her unborn puppies, transplacental transmission.
Mother to puppy, that's a concerning thought. So a newborn could, already be infected.
It is possible, yeah. Now, once the parasite gets into the body, there's this build-up period before it causes noticeable illness.
The incubation period.
Exactly. On average, it's about 2 weeks. But here's the tricky part.
Uh-oh.
In some cases, it can take months or even years before the infection is obvious, before you get a clinical diagnosis.
Years. So an animal could be carrying it without showing any signs for a really long time.
A very long time, potentially. They can be asymptomatic carriers.
That silent period makes early detection really important, I'd imagine.
Crucial.
So once these pyroplasms are in the bloodstream, what kind of trouble are they actually causing inside the body?
Well, the primary problem is that they invade and then replicate, multiply inside the red blood cells.
Okay.
This directly damages and destroys those cells. That leads to hemolytic anemia, the breakdown of red blood cells.
All right. Makes sense.
But here's where it gets really interesting. It looks like the animal's own immune system, while trying to fight the infection, also starts destroying red blood cells.
Seriously. The immune system turns on itself.
In a way, yes.
Yeah.
This immune-mediated destruction is likely a more significant factor in causing the actual clinical illness we see.
Wow.
So the severity of the disease doesn't always directly match up with, how many parasites you can actually count in the blood.
Okay, so it's a double whammy, the parasites themselves and the body's reaction to them. That's a really crucial point.
Absolutely.
Now, which body systems are typically hit hardest by babesiosis?
The effects can be pretty broad, actually. We definitely see impacts on the blood, the lymph nodes, the immune system. That's where the anemia comes in.
Okay.
And interestingly, we often see a drop in platelets, too. That's called thrombocytopenia.
Does that cause bleeding problems?
Serious bleeding is actually rare, but the low platelet count is very common. Fever is typical, too. And an enlarged spleen, splenomegaly, and swollen lymph nodes, lymphadenomegaly. Those are common findings.
Right.
And in research settings, they've also seen inflammation of blood vessels, vasculitis, so it shows how widespread the effects can be.
So it's hitting the blood and immune system pretty hard. What about other organs? Does it affect, like, the liver or kidneys?
The liver can definitely be affected. We often see mild to moderate increases in liver enzymes on blood tests.
But that's not the only sign, right?
No, absolutely not. It's just one piece of the puzzle. Neurologically, especially with that more severe B. canis rossi we mentioned.
From Africa?
Yeah. We can see something called cerebral babesiosis that can lead to weakness, disorientation, even collapse. Scary. And yes, the kidneys can also take a hit. Kidney failure has been reported with both B. canis rossi and that B. annis species.
It really sounds like a serious and, well, complex disease. It affects multiple systems.
It certainly can be.
Are certain types of animals more likely to get it, like specific breeds or ages?
Well, in dogs, really any age or breed can get infected.
Okay.
But we do see some trends. B. canis infections seem to be, more common in greyhounds.
Really? Why is that?
We don't fully understand why. Actually, maybe genetic factors, maybe exposure. It's not totally clear.
Interesting.
And B. gibsoni, the Asian type, that one has a higher incidence in American Pit Bull Terriers.
Ah, and that might be linked to the dog bite transmission.
That's the thinking, yes. The increased risk of direct blood transmission through bites in that breed could play a role.
Okay. And cats.
For cats, again, any age or breed can be affected. And here in the U.S., remember, it's primarily Cytozoon felis that we're dealing with.
Right, C. felis. And the actual signs of illness, are they always obvious? Or can they be subtle? Like, could my pet have it and I wouldn't know?
The clinical signs can vary quite a bit, a huge range, really.
Yeah.
We can see peracute cases, very sudden, very severe,
Okay.
more gradual onset acute cases, and even chronic infections that just kind of linger.
Chronic. So it can grumble on for a while.
It can, and importantly, as we mentioned, some animals can be carriers and show absolutely no signs of being sick.
None at all.
None. They're infected, they can potentially transmit it, but they appear perfectly healthy.
So it can be a hidden threat in some animals. That's worrying.
It is.
When dogs do show symptoms, what might owners notice? What should you look out for?
Okay, common signs in dogs include being unusually tired, lethargic.
Swept out.
Yeah, really low energy, loss of appetite, anorexia, pale gums. That's a key sign of anemia.
Check the gums. Got it.
Fever, definitely. An enlarged spleen or lymph nodes, your vet might feel those during an exam. Dark-colored urine, sometimes called pigmenturia.
Like tea-colored.
Exactly, or even darker. Jaundice, which is that yellowing of the skin, gums, and whites of the eyes. Weight loss over time. And even changes in the color of their stool.
Wow. Quite a list. And in cats, are the signs similar? Or are they different?
There's definitely some overlap. We often see lethargy, anorexia, pale gums, and jaundice in cats with babesiosis, or more accurately, with psychozoonophilis here.
Okay.
While maybe the range of signs reported specifically for C. felis in U.S. cats is currently a bit narrower than the whole spectrum we see in dogs with various Babesia species, these signs, lethargy, anorexia, paleness, jaundice, are still very serious and absolutely require prompt veterinary attention.
Absolutely. Okay, so we have a pretty good picture now of what babesiosis is, who it affects, the different types, and what the signs might be. Let's shift gears a bit and talk about what actually causes it, or rather what factors might put an animal at greater risk.
Okay, well, the biggest risk factor, hands down, is a history of tick attachment.
No surprise there.
Right. Since ticks are the main way many of these Babesia species are spread, if your pet has been bitten by an infected tick, their chances of getting babesiosis go way up.
Makes sense.
Also, we mentioned this briefly, but animals that have had their spleen removed, splenectomized animals, they tend to develop much more severe illness if they do get infected.
Right, because the spleen is involved in filtering the blood and the immune response.
Exactly. It plays a key role. And related to that, a history of splenectomy, or being on chemotherapy, also seems to increase the risk for that specific Babesia salpococo we talked about earlier.
The one that targets immunocompromised dogs.
Correct. Additionally, in dogs that are already carrying the parasite asymptomatically.
The hidden carriers.
Yeah. Anything that weakens their immune system, stress, other illnesses, certain medications that can sometimes trigger the onset of clinical signs, the parasite load can increase and they suddenly become sick.
So stress or another sickness could push a carrier animal over the edge into being actively sick.
Precisely. That can happen. We also see, going back to transmission, that recent dog bite wounds can be a risk factor specifically for B. gibsoniasia infection.
Highlighting that direct blood route again.
Yep. And lastly, a recent blood transfusion. If the blood comes from a donor that's subclinically infected carrying the parasite without showing signs that can transmit the infection too.
Wow, that really underlines the importance of screening blood donors carefully, doesn't it?
Absolutely critical. You have to be very careful.
Okay, so if a vet suspects babesiosis based on the signs and risk factors, what other conditions might they need to consider? What else could look like this? It sounds like there's a lot of overlap.
There really is. That's a crucial part of the diagnostic process, ruling things out, the differential diagnosis. The signs of babesiosis, especially the anemia and low platelets, overlap with many other illnesses.
Like what?
Well, other immune-related problems are high on the list. Things like primary immune-mediated hemolytic anemia, IMHA, or immune-mediated thrombocytopenia, ITP.
Where the body attacks its own cells without an obvious trigger like babesia.
Exactly. Also, other tick-borne diseases are major considerations. Ehrlichiosis, Rocky Mountain spotted fever, anaplasmosis, these can cause similar signs.
All carried by ticks too, often.
Often, yes. Makes it complicated. Then you have things like systemic lupus, erythematosus, certain types of cancer like lymphoma or hemangiosarcoma, infections of the heart valves, endocarditis, and even other blood parasites. In dogs, things like hemotrophic mycoplasmosis, formerly Hemobartonella. In cats, cytozoonosis is the big one, but other things need to be considered too.
It really sounds like a bit of a diagnostic puzzle for the vets to solve.
It absolutely can be. And here's another important point, a positive Coombs test.
What's that test for again?
It detects antibodies attached to red blood cells, indicating the immune system is attacking them.
Right.
So you might think a positive Coombs test points toward primary IMHA and away from babesiosis, but actually, many animals with babesiosis will also have a positive Coombs test because of that immune-mediated component we discussed.
So a positive Coombs doesn't rule out babesia.
Definitely not. It just confirms an immune component is present, which can happen in both conditions. So vets also need to think about non-immune causes of anemia toxins, certain drug reactions, zinc toxicity from eating pennies, inherited blood disorders.
Wow.
And if jaundice, that yellow color, is a prominent sign, they'll need to investigate other causes of liver problems too, or issues with bile flow.
Okay, so a thorough investigation, lots of detective work is absolutely key.
Couldn't have said it better.
What are the main lab tests then that specifically help pinpoint babesiosis?
Several things come into play on the routine labs, the CBC, chemistry panel, urinalysis. These give us important clues.
Okay, like the CBC.
On the complete blood count, we might see anemia. It can range from mild to really severe. Often the body is trying to compensate by releasing young red blood cells, so we call it regenerative anemia.
Trying to keep up.
Exactly, but in very sudden paracute cases, that regenerative response might not have kicked in yet. And interestingly, anemia isn't always present. Sometimes the red cell count is normal.
Really?
Yeah, but a low platelet count, thrombocytopenia, that is very common. It might even be the only abnormality you see on the CBC initially.
Just low platelets?
Could be. White blood cell counts can be variable, high, low, or normal, depending on the stage and severity.
Okay. What about the biochemistry panel and the urine tests? What might those show?
On the biochemistry, we often see hyperbilirubinemia, high bilirubin levels in the blood. That comes from the breakdown of red blood cells.
Makes sense with the hemolysis.
Yep. In chronic infections, we might see hyperglobulinemia, an increase in antibody proteins in the blood. Mildly elevated liver enzymes like ALT and AST can occur, often secondary to the anemia causing reduced oxygen supply to the liver or maybe some direct effect.
Okay.
We might see proteinuria proteins spilling into the urine and hypoalbuminemia, low albumin protein in the blood, which can suggest kidney involvement.
Especially with those specific species, right?
Right. Especially with B. canis rossi and B. annae, we might see azotemia, increased kidney waste products in the blood, and metabolic acidosis, indicating more severe kidney dysfunction. And the urinalysis might show bilirubinuria, bilirubin in urine, or hemoglobinuria, hemoglobin in urine from Liley's red cells. Hemoglobinuria is maybe more common outside the U.S., but possible.
So these routine tests give a general picture, lots of clues pointing towards hemolysis and inflammation. But how do you actually confirm it's Babesia causing it? How do you identify the parasite itself?
Good question. The most direct way, the classic method, is actually looking at stained blood smears under a microscope.
Just looking for them.
Yep. If you have someone experienced looking at the slides and they use the right staining technique, you can sometimes actually see the little pyroplasms, those merozoites, inside the red blood cells.
Wow.
Taking blood from a small vessel, like an ear vein, sometimes increases the chances of finding them, as they can congregate in capillaries. But it can be tricky. The number of infected cells can be low, especially in chronic cases or carriers. And microscopy alone often can't tell you exactly which species or subspecies of Babesia it is. They can look similar.
Right. So it's possible, but not foolproof and maybe not specific enough. What about those antibody tests you hear about, IFA tests?
Yes, indirect fluorescent antibody tests. These look for antibodies in the blood that the animal's immune system has produced against Babesia.
So they show exposure.
They show exposure, yes. And they can be helpful. But they also have limitations. One issue is cross-reactivity. Antibodies against one type of Babesia might react with the test for another type, making it hard to pinpoint the exact species.
Okay.
Also, in the very early stages of infection, like the first couple of weeks, the animal might not have produced enough antibodies yet to be detected, so you could get a false negative. Same thing can happen in very young animals whose immune systems aren't fully developed.
So the antibody tests aren't always the final answer either. What's considered like the gold standard or the most reliable way to diagnose it these days?
Increasingly, PCR is becoming the go-to method, polymerase chain reaction.
PCR, we hear about that a lot.
We do. This test looks for the actual genetic material, the DNA of the Babesia parasite in a blood sample.
Oh.
It's generally more sensitive than looking under a microscope, meaning it can detect lower levels of infection. And really importantly, PCR can often differentiate between the different species and subspecies of Babesia.
So it can tell you if it's B. gibsoni versus B. canis vogeli.
Exactly. And knowing the specific type is really important because, as we'll discuss, it can affect treatment choices.
Right. PCR sounds like a very powerful tool then. Okay, so let's say you've got a diagnosis confirmed by PCR or other tests. Let's talk treatment. How do we actually manage babesiosis? What are the general approaches?
Well, treatment really depends on how sick the animal is. Some might be stable enough for outpatient care, but many, especially those with severe anemia or complications, will need to be hospitalized for more intensive care. Supportive care is absolutely essential. This includes things like intravenous fluids if they're dehydrated or in shock. And if the anemia is severe, if the packed cell volume drops too low, they might need blood transfusions to stabilize them and buy time for the other treatments to work.
Right, getting those red blood cells back up. What about the medications that specifically target the Babesia parasite itself, the anti-protozoal drugs?
Yeah, we have a couple of main players there. Imidocarb dipropionate is the one approved for use in dogs here in the U.S.
Imidocarb.
And then dimethazine acetate is widely used in other parts of the world.
Dimethazine.
These drugs are generally quite effective against the larger Babesia types like B. canis. They can significantly reduce illness and death, And they might even completely clear the infection in many cases of B. canis.
But maybe not always for the smaller types?
That's the catch. They often aren't as effective at completely clearing infections with the smaller pyroplasms, particularly B. gibsoni-Asia. The dogs might feel better, but they often remain carriers.
Okay. So what do you use for B. gibsoni then?
For B. gibsoni-Asia, the current treatment of choice, based on studies, is actually a combination therapy.
A combo.
Yeah, usually azithromycin, which is an antibiotic, combined with atovaquone, another anti-protozoal drug. This combination, given for about 10 days, has shown pretty good success in actually eliminating the B. gibsoni infection in a majority of dogs treated.
That's good to know there's a specific, more effective treatment for that particular type. Are there other drug combinations being explored or used?
Yes, definitely. Research is ongoing. Several other combinations have shown some promise in studies, although we might not have fully established standardized protocols for all of them yet.
Like what?
Things like combining clindamycin, another antibiotic with some anti-protozoal activity, with metronidazole and doxycycline, or another combo using doxycycline and rofloxacin and metronidazole.
Wow. Multiple drugs.
Yeah, the idea is hitting the parasite from different angles. The length of these treatments can vary, sometimes needing weeks of medication. Sometimes single drugs like metronidazole, clindamycin, or doxycycline are used alone.
But do they work as well?
Generally, reports suggest they might just reduce the clinical signs, maybe lower the parasite numbers temporarily, but they usually don't completely clear the infection, especially with B. gibsoni. The combination therapies seem more effective for achieving a cure.
Okay. And what about for cats? You mentioned B. felis and C. felis.
Right. For B. felis, which is mainly seen in Africa, the main treatment reported is primokine phosphate. For C. tozoon felis, which we see in the U.S., treatment has historically been challenging with high fatality rates, but newer protocols combining atovaquone and azithromycin, similar to the B. gibsoni treatment in dogs, have shown significantly improved survival rates. So that's a positive development.
That is good news. Now, what about that immune system component we talked about? The body attacking its own cells. Are there ways to manage that part of the disease?
Yes, that's an important consideration, since the anemia and the low platelet count are often, at least partly, due to this immune-mediated destruction. Immunosuppressant drugs, like prednisone or other corticosteroids, might be used. Usually this is considered in cases where the animal isn't responding well enough or quickly enough to just the anti-parasitic drugs alone.
Okay.
But, and this is absolutely crucial, these immunosuppressants should not be given before starting the specific anti-Babesia medication.
Why not?
Because if you suppress the immune system before you start killing the parasite, you could actually make the parasitic infection explode. You could make things much, much worse.
Oh, wow. Okay, so anti-parasite drugs first, then consider immunosuppressants if needed.
Exactly. Get the parasite under control first. That's the priority.
That's a really, really important caution.
Yeah.
Are there any potential side effects owners should be aware of from the drugs used to treat babesiosis itself, the imidocarb or diminazine?
Yes, there can be. Both imidocarb and diminazine can sometimes cause cholinergic side effects.
Cholinergic, like what?
Things like excessive salivation, drooling, sometimes diarrhea, maybe some muscle tremors. It's related to how the drug works on the nervous system.
Okay. Can you manage that?
Often, yes. Vets will sometimes pre-treat with another drug called atropine before giving the imidocarb or diminazine injection, and that can help block or reduce those side effects.
That's to know.
It's also important to be aware that high doses, or sometimes even standard doses in sensitive individuals, of imidocarb and diminazine can potentially cause toxicity to the liver and kidneys.
Oh.
So it's vital to use the correct, carefully calculated dosage based on the animal's weight. And often vets will monitor liver and kidney values during or after treatment, especially if multiple doses are needed.
So careful monitoring during treatment is really important then.
Absolutely essential.
What does the follow-up care usually look like after treatment starts? How do you know if it's working?
Follow-up typically involves repeating those blood tests we talked about, the CBC and the biochemistry panel.
Checking the anemia and platelets.
Exactly. Checking if the anemia is resolving, if the platelet count is coming back up, if the bilirubin levels are normalizing, if the liver and kidney values look okay. Most animals, if they're going to respond, will start to show clinical and hematological improvement within, say, a week or two of starting appropriate treatment.
That's relatively quick.
It can be, thankfully. Now, to confirm if the parasite has been completely cleared, especially after treatment for something like B. gibsoni, where we're aiming for elimination,
Right.
It's generally recommended to perform follow-up PCR testing.
Using PCR again?
Yep. The recommendation is usually to do 2 or 3 consecutive negative PCR tests, often starting about 2 months after finishing the treatment course.
2 months later. Why wait so long?
Good question. It's thought that waiting allows any residual non-viable parasite DNA to clear out, so you're less likely to get a false positive result right after treatment. A series of negative PCRs provides more confidence that the infection is truly gone.
Okay, that makes sense.
Okay.
What about the antibody tests, IFA? Are they useful for follow-up?
Not really, no. Antibody titers aren't reliable for monitoring treatment success.
Why not?
Because the antibodies can persist in the bloodstream for a long time, months, even years, even after the infection has been completely cleared. So a positive antibody test doesn't tell you if the animal is still actively infected. PCR is much better for determining current infection status after treatment.
Got it. PCR for follow-up, not antibodies. And you mentioned earlier that for some of the less common Babesia species like B. conradi or B. annae or B. felis in cats, we maybe don't have as much long-term data.
That's true. While we have treatment approaches, the amount of published long-term follow-up data, including confirmation of parasite clearance with PCR for some of these rarer species, is still somewhat limited compared to, say, B. canis or B. gibsoni. Research is always ongoing, though.
Okay. What if a dog in a kennel setting is diagnosed, like in a breeding facility or a shelter? Are there special considerations there?
Yes, absolutely. Because, as we know, a significant number of dogs in kennel situations can be subclinical carriers of Babesia, especially B. canis or B. gibsoni.
The asymptomatic ones.
Right. If one dog in that kennel is diagnosed with clinical babesiosis, it's generally recommended that all dogs in that kennel environment should be tested for Babesia, usually with PCR.
Test everyone, even if they seem healthy.
Yes, because the carrier rate can be high, and identifying carriers is important for managing the health of the whole group and preventing further spread, perhaps through shared needles, fights, or even ticks within the facility.
That makes a lot of sense.
Mm-hmm.
Need to get a handle on it within the group. And what if an individual animal just isn't getting better with the initial treatment? What should be considered then?
That's a really important scenario. If an animal isn't responding as expected to standard babesiosis treatment, you have to strongly consider the possibility of co-infection.
Other bugs at the same time?
Exactly. Ticks often carry more than one type of disease-causing agent. So the animal might have babesiosis plus Ehrlichia or Anaplasma or maybe Bartonella or even hemotrophic mycoplasma or leishmania in certain areas.
Well, a double or triple whammy.
It happens. These co-infections can definitely complicate the clinical picture, make the illness more severe, and might require additional or different treatments targeted at those other organisms. So further diagnostic testing for co-infections is often warranted in non-responsive cases.
Okay. So considering all this, the difficulty in diagnosis sometimes, the potentially severe illness, the carriers, the treatment challenges, prevention really seems like the best approach, doesn't it?
Oh, absolutely. An ounce of prevention is worth pounds of cure here, truly.
What can pet owners do? What's the most important thing to protect their animals?
Tick control. Full stop.
Just keep the ticks off.
That's the cornerstone. Using effective tick preventatives, acaricides, regularly, year-round in many areas is the single most important thing you can do. There are many excellent products available, spot-ons, oral medications, collars. Talk to your vet about the best option for your pet and your region.
And using them consistently is key, right?
Consistently and correctly, yes. And in addition to preventatives, checking your pet for ticks daily, especially after they've been outdoors in grassy or wooded areas, and removing any ticks you find promptly and properly is also crucial.
How quickly do you need to remove them?
Well, transmission time can vary depending on the Babesia species and the tick, but generally the quicker you remove an attached tick, the lower the risk of disease transmission. Some studies suggest it might take 24, 48 hours or more for transmission for some types, but why risk it? Get them off ASAP.
Good advice.
And some recent research even suggests that consistent year-round use of effective tick preventatives can actually prevent Babesia infections altogether, not just reduce the risk.
Really, prevent it completely.
That's what some studies are indicating. It's a really powerful message about how crucial these preventatives are for all pet owners, especially if you live in or travel to areas where ticks and babesiosis are known to exist.
Definitely. Are there any vaccines available? Can we vaccinate against babesiosis?
That's a common question. There are vaccines available in some parts of the world, primarily in Europe.
Yeah.
These vaccines are typically targeted against specific types of B. canis, namely B. canis canis and B. canis rossi. They may help reduce the severity of disease caused by those specific strains.
But they don't cover everything.
No, and that's the important limitation. These European vaccines are generally not expected to provide protection against other important Babesia species, like B. gibsoni, or the Babesia species commonly found here in the United States, like B. canis vogeli.
So a vaccine bought in Europe wouldn't likely help a dog in the U.S. against the local strains.
Unlikely to provide significant cross-protection, no. So while vaccines are part of the prevention strategy in some specific regions for specific strains, they aren't a universal solution right now, and they definitely don't replace the need for diligent tick control everywhere.
Tick control remains king. Well, we've certainly gone deep into babesiosis today. It's clear that it's a really complex parasitic disease. Lots of different species and subspecies affecting both dogs and cats. And primarily spread through those pesky ticks, although other routes exist. Getting an early diagnosis, using the right tests like blood work and especially PCR, and then starting the appropriate, sometimes intensive treatment quickly seems really crucial for a good outcome.
Definitely. Prompt action makes a huge difference.
And the take-home message for everyone listening has got to be about prevention. Year-round, effective tick control for all our furry friends is just absolutely vital, non-negotiable, really.
Couldn't agree more. It's the best defense we have. And, this whole discussion leads to an interesting kind of closing thought for you, for the listeners, to ponder. Yeah. Considering all these different Babesia species, the various ways they can be transmitted, not just ticks, remember the bites and transfusions, and especially the fact that some animals can carry these parasites without being sick at all. How might our understanding of this disease continue to evolve? As scientists do more research, as vets become more aware of it in different regions, especially with PCR becoming more common, how might that change the picture? And thinking even bigger, what role might changes in our environment, climate change affecting tick ranges, habitat changes play in how these fascinating yet troublesome parasites spread and maybe become more or less common in different places in the future?
Wow. Yeah, that's definitely something to think about, where this all heads next.
Exactly. It's a dynamic field, and there's still a lot to learn.